Well, this is a 44 years male. You are seeing the urinary bladder, the prostate. This is the urinary bladder, this is the prostate. And here you are seeing in the longitudinal section the urinary bladder. Now towards the right side, adjacent to the ureter, say this is the urinary bladder. So at a distance of approximately 2.5 centimeters, we see a mixed echo mass. This is the urinary bladder in longitudinal section, this area, and this is the mass, this area, which appears to be hyperechoic in the center and hypoechoic at the periphery. Now you see this, here I showed you in fact the purpose of showing this view was to show you the distance of this mass from the urinary bladder. It's in the region of the right iliac fossa to right lower. It extends from the right iliac fossa to the right lower abdominal quadrant. This is its total dimension. Now this is the total dimension of the mass noted in the mentioned region. It measures approximately 11 centimeters in by 8 centimeters. And what you are seeing is now in this view you see low level echogenic areas. Why it is bowel related, you see, this is the air within this pocket of and now this is appearing as a pocket of fluid with dependent region echoes, whereas we know that this is a bowel relating mass. Therefore this is the fluid compartment of the bowel mass, and this is the air giving dirty shadow. Bowel or a segment of the bowel which is giving dirty shadow, and this measures 7.4 by 5.8 in this dimension. So this mass that we are studying gives you a fluid pocket along with air shadows and bowel segments within it, trapped within it. Here it is. Now the measurement is something around 9.6 by 5.8, and I will take it as the correct dimension. This is the air within the trapped air within the bowel segment, and this is giving dirty shadow. This is a dirty shadow, this one. Now so far as the wall of this mass is concerned, the wall is thin, measuring only 3.0 millimeters, 3 millimeters, and there are a few echogenic areas protruding within the fluid compartment of this bowel-related mass. This is the sagittal Now there are multiple echogenic areas instead. This is all fluid, and there are echoes within this fluid. It's not a clear fluid, and this we are seeing in the region of the right iliac fossa. That extends into the right lower abdominal quadrant. This is a bowel mass. So it's most probably an ileocecal mass. These echogenic areas you are seeing within this bowel segment, along with few septations with a fluid compartment. Here you see these are the trapped air particles within the lumen of the. This is the lumen of this bowel-related mass. Now there is no peristaltic movement seen in this mass. There is no evidence of any regional adenopathy. Now, how will you proceed with such a case? What else would you like to see in such a case? These are air. This is air with comatal artifact, and this is the bowel mass. Ileocecal mass, most infective nature. It is not of an aggressive nature. So this is the lumen, and you can see that the fluid compartment of this echogenic area of this bowel mass. Here, if you see, this is a bowel segment giving dirty shadow. From where onwards we see this echogenic mass, mixed echo mass with fluid compartment and with multiple echogenic areas within it. Now this is an air giving comatal artifact. This is air particle. Okay. So what we will do is now, I would like to see if there is any splenomegaly, para-aortic lymph nodes. I would like to see any pleural effusion. Now this mass is okay. This is an ileocecal mass of infective nature or of benign nature, and there is no other associated pathology seen. However, a segment of bowel measuring approximately 7.5 centimeter by 2 centimeter with trapped air within its lumen and wall thickness of 4.8 millimeters is seen extending from the lateral margin of the cystic area of the bowel mass in midline anteriorly. You see, this is the mass. And here it becomes continuous with the other mass I showed you. So we should keep the possibility of intersusception in our mind. Now you see that this is the part of the bowel that appears to be collapsed, and wall thickness, we noted, was about 4 millimeters, and this irregular broken echogenic area is the trapped air within the lumen of this bowel segment, which is relating to the globular area of this bowel mass. This is a bowel mass, ileocecal mass, but here it is just a linear structure, tube-like structure with trapped air. Now this is also a bowel segment. This is a bowel segment. And this is the wall of this bowel segment. This is the air, trapped air. No peristaltic movement is seen within this segment of the bowel. And the other one, which is seen cystic and solid with air in it, and is thick wall. This is a thick, rather thick wall of this bowel-related mass, and this is its dimension. So we have to keep the possibility, two possibilities I will keep in this case. One, that it is a ileocecal mass of benign nature, most probably of pox infection. Secondly, it can be secondary pressure would be the diverticulitis. Now let's see if there is any evidence of suprenomegaly. Okay, this is the spleen, and the spleen is within normal dimensions. No pleural pain was noted on that side. This is the liver. No pleural pain on this side. Kidney is okay. This is the aorta, no para-aortic lymph nodes. So this is the case of the